Now that children as young as 5 are able to get the COVID-19 vaccine, what can they expect? Dr. Maja Artandi with Stanford Health Care joins us now to talk about that. And first, let's talk about the dosage. How much smaller is it compared to adults?
The CDC finally approved the Pfizer COVID-19 vaccine for children aged 5 to 11. This is a major milestone in finally getting rid of this pandemic and going back to our normal lives. As in adults, the children 5 to 11 will get 2 doses 3 weeks apart, but the dose is very different. The dose that the children 5 to 11 get is only 10 micrograms, which is 1/3 of the dose that children 12 and up and adults are getting. Also, the 5 to 11-year-olds will get the dose applied with a much smaller needle. The Pfizer trial included about 5,000 children, and in that trial, they showed that the vaccine is 91% effective in preventing symptomatic COVID infection, and it's very safe. Side effects are mostly a sore arm, maybe a little bit of a fever, and body aches.
So pretty similar to if you get a flu shot.
Yeah, pretty much.
Okay. Where can kids get that vaccine?
So the easiest way is to just go on the federal website, VACCINES.GOV, and then you can find out where you can get the vaccine. Now, it's a much bigger effort to get that vaccine off the ground than the 12 and up year old because, again, the dose is much smaller. And in order not to get the small kids the higher dose, the packages need to be specially labeled, again, smaller needles, different caps. So it's a much bigger effort. But I think by the middle of this week, enough vaccine should have been shipped out to get the vaccination effort off the ground.
And we've heard that COVID vaccines could be linked to a small risk of heart problems. How much of a concern is that?
So the heart problem you're referring to is called myocarditis. That's an inflammation of the heart muscle. Myocarditis normally is caused by viral or bacterial infection. Symptoms are fast heart rate or irregular heartbeat, shortness of breath, and chest pain. Globally, about 10 to 20 out of every 100,000 people get myocarditis, symptomatic myocarditis every year. There might be many more getting that, but they don't have symptoms, so they don't go to their doctors. As we all know, the mRNA, which is the Pfizer and the Moderna vaccine, it has been linked to myocarditis. That risk is really rare. And fortunately, that myocarditis is very mild and self-limited. Myocarditis from COVID-19 is much worse and can cause permanent heart damage. Now, who gets myocarditis from the mRNA vaccines? And mostly it's actually the Moderna mRNA vaccine that causes the myocarditis. Studies have shown it's mostly the 16 to 29-year-old guys, so men, get it much more often than women. And it's after the second dose of the vaccine.
Okay. So some parents are taking the wait and see approach with their children. They're getting all this info and still a little concerned. What do you tell parents who may be skeptical of the vaccine?
As a parent, I completely understand when parents are concerned about the vaccine. It's a very new vaccine. A trial or a recent study showed that only 27% of parents are eager to get out and get their kids vaccinated right now. 30% said they wouldn't get their kids vaccinated. And I can understand that because, again, it's a new vaccine and COVID-19 typically is a very mild disease in children. However, not always. So far, about 8,000 or more than 8,000 of the 5 to 11-year-olds have been hospitalized with COVID. 1/3 end up in the ICU. About 200 people, kids 5 to 11, have died from COVID-19. In the last months, the unvaccinated 5 to 11-year-olds went back to school, and we saw a surge in COVID-19 vaccines in that age group. And even again, if those kids don't get as sick, they still can transmit the virus to more vulnerable adults. About 120,000 children have lost a parent or caregiver to COVID-19. So what I would say is please go to the pediatrician, please ask them all the questions you have, and strongly consider getting your kids vaccinated.
And this is a large percentage of the population that is now eligible to get vaccinated. How significant of a step is this in terms of getting us to the end of the pandemic?
So there are about 28 million 5 to 11-year-olds living in the United States. This is the largest group of people that until now has not been eligible to get the vaccine. And as I said before, those kids in the last few months have gone back to school unvaccinated. So far, about 6 million children have been infected with COVID since the beginning of the pandemic, and about a third have been infected just in the last 11 weeks because Delta is much more aggressive. Again, those kids often don't get very sick, but they can transmit the virus to other people. So vaccinating kids will definitely make a dent in the pandemic, but it depends on how many kids get vaccinated. The larger the number of kids vaccinated, the bigger the effect.
Okay. A lot of really good information there for parents who are still concerned about this vaccine. So thank you, Dr. Maja Artandi with Stanford Health Care, for your time.
Of course.